Welcome back to Rnscrub. Today we're going to be going over how to use RockTape if you have Patellarfemoral pain syndrome. Now, if you've ever played sports or have been next to people who do play sports, maybe you're a medical professional who works in PT, OT, you've probably seen this RockTape everywhere, right? So what is this RockTape really about? Let's just go through this really quick. They do have different types, but this specifically is the standard version. How does it work exactly? RockTape microscopically lifts the skin away from the muscle and fascia below, creating a decompressive effect. It's stretchier, stickier, and stronger than the competition. It is preferred by athletes and medical professionals throughout the world. So, this relieves swelling through decompression, which speeds recovery. This increases awareness of your body position to help you maintain proper posture and form. It is ultra strong and sticky, hypoallergenic, adhesive, water resistant, 97% cotton, 3% nylon, 180% stretch for full range of motion, latex and zinc free. It sticks 2 to 7 days each use, and each row is about 2 inches by 105 feet and 5 centimeters by 32 meters. As you see here, I'm just pulling this back to show you exactly what it is. It's one of those very pliable, almost like bandage tape-like combinations. As you can see here, it's very sticky and very malleable. So let's get to taping, shall we? Up next, you'll see my physical therapist taping up my knee for my Patellarfemoral pain syndrome, or runner's knee.
Keep your knee straight.
First up, she's just wiping my knee down with some alcohol and a dry towel, as you want to make sure that the skin is absolutely clean before you start taping. It helps the tape stick much better to your skin. And all she's doing right here is just measuring before she cuts the tape. So she simply just put it across my knee. There's no exact measurement there, but just eyeballing it right across like that.
This will stabilize,
and then she cuts the tape
part,
and then she peels it off.
It won't hurt when
then
you move much.
Place the tape directly onto the portion. This portion is right at my patella, right underneath it. That will form the base for this little, almost like a cradle for my knee.
I'm going to put it up here.
It's going to be done the same way with the medial portion as well as the lateral portion of my knee. And remember, this is to help with my runner's knee.
And a little bit. Yeah. Can you pull this up?
Yeah.
Okay. Okay. Yeah.
Oh, you're there? Okay.
Yes.
Thank you.
No problem.
And as you've seen, she just places it from the inner portion right below the patella to the lateral. And she's going to do the same thing, but on the opposite end, going medially. This creates a cradle or support for my knee. And there you have it. Thanks so much for watching. Make sure to comment, like, and subscribe. Bye, guys.